My research paper, Avatar Therapy for Auditory Verbal Hallucinations in People with Psychosis, a single-blind randomised controlled trial, was published in Lancet in 2017. This was building upon the work of Kuh and his colleagues in 2006. He demonstrated that schizophrenic patients can perceive avatars as human, which led to my colleague Leff's seminal work in 2008, which developed avatar therapy with very promising results. Participants reported a reduction in auditory hallucinations, as well as a decline in omnipotence and malevolence of the content of the voices. For example, one participant, who had been sexually abused by an older man, was able to speak with the avatar and the voice ceased after 13 years of torment, which demonstrated that avatar therapy had the potential as a treatment. Therefore, I wanted to establish whether this therapy is clinically effective, especially in comparison to supportive counselling. To do this, I recruited 394 participants, and 150 were suitable for the trial, based on having distressing auditory verbal hallucinations or psychotic symptoms for at least 12 months. First, the patients created a digital representation of the voice using a software to make it look and sound most similar to their voice. The patient also provided me with phrases that the voice would typically use. Myself or another therapist sat in a different room so we could talk as both the avatar and the therapist. The patient sat in a room with the avatar on screen. The therapy took place once a week for 6 weeks. In the beginning, the sessions were for exposure to the avatar, with the therapist promoting the patient to be assertive and challenge what the avatar said. The last 3 sessions focused on the avatar acknowledging the strengths and qualities of a participant in order to boost their self-esteem. The other group, supportive counselling, focused on improving quality of life, processing past trauma, and increasing self-esteem. It did not include attempts to change relationships with the voices, as this was being assessed in avatar therapy.
You're pathetic.
No, I'm not.
You can't understand that to me.
Yes, I can.
How come you're so confident?
Because I'm not going to listen to you anymore.
Hi, I'm Susan, and I was diagnosed with schizophrenia 5 years ago. I was really disillusioned with the antipsychotic medication that I was on, which I didn't feel was effective in managing my symptoms, and my voices were causing me significant distress. That's why I was keen to be a participant in this trial. Before, I was with John and avoided social situations, as my voices really affected my self-esteem, constantly attacking my self-worth. Since the therapy, I feel like a new person. For me, the greatest benefit was the new level of control I have over my voices. I love meeting and having coffee with my friends, and I'm much more open to new experiences. The therapy doesn't end with the trial. One of the great things about avatar therapy is the MP3 recording they give you of the sessions, which during low moments I can plug in and regain my control over the voices. I really wish something like this had been around at the time of my diagnosis, as it would have saved years of distress, and I would recommend it to other individuals with schizophrenia. And I really think that the NHS Trust should take it up as a treatment option.